disease. The what about the family fixed, maybe you can go to the
But she will have host that she's not symptomatic, that's why he said not needed. Any other reason why you should do vocal cord assessment? Baseline is one. Second is
Paralyzed due to viral infections.
some viral infections can do the paralysis. Now, is there some voice study that you do? Any EMG study? Yes. There is a voice evaluation study which is also done. In spite of the cords moving normally, the voice may not be good. Some people have husky voice and then they claim for a compensation after you have done the surgery. Mahinder, now I am husky because of you. Pay me the money. You have a baseline nowadays, voice, quality of voice test. So it's not just indirect laryngoscopy, right? Now quickly, within 1 minute, how do you take the consent from the patient? How do you take the informed consent?
So I would explain regarding the surgery and what operation I am going to do, what are the harmful effects of the surgery and what are the beneficial effects and what are the consequences like hypoparathyroidism and hypothyroidism and vocal cord, injury to recurrent laryngeal nerve and post-operative complication like
You're missing another important nerve.
so external laryngeal nerve.
What does that do if it is injured?
Vocal cord will be in
No.
abducted position.
Normally it tightens the
It will
cords and affects the cord. So if it is injured unilaterally, there will be no major effect. But if
But
it is-
voice will be suffering, the pitch will
Voice will
be
be
suffering, the
And
timbre
voice
of
will be weak.
the timbre of the voice will go, the pitch of the voice will go, the speech will be affected. Singers, leaders, politicians, they will be suffering. Right?
Yes, sir.
Now, you have mentioned about what we are going to do. How do you identify parathyroids during surgery?
So parathyroid is present 1 centimeter around the crossing of recurrent laryngeal nerve at the inferior thyroid artery in the tracheus, near the ligament of Credi. So it is embedded in fat tissues.
Good. Anything you would like to add, Abhinav?
So one is the location which is already mentioned, and second is the lobe of fat which is surrounding the parathyroids. Third is the bleeding which is diffuse, and in cases of fat it is pinpoint. Then about the color of the parathyroids, it is reddish brownish. Then
Loudly.
So sight and central pad of fat and change in color. Change in color when we it is normally yellowish in color, yellowish brown. When we point it with the bring the forceps near, it changes its colors into red.
Well, one thing, Sudhir, one is location. Superior parathyroid is usually fixed in location. Inferior is going places because it develops with the thymus. So inferior parathyroid could be found in the thyrothalamic ligament. So lower down. And remember, inferior parathyroid is in a superior plane. Superior parathyroid is in an inferior plane. Now, that's a recurrent. And inferior thyroid artery goes cross, isn't it? And sometimes the nerve goes in between the branches, etc. And this is the space, this is the triangle where you find parathyroid. So one is the location. One is the location. The next is, if you have this gland found here, then that's fine. The next is the color. Color is golden yellow. When handled, as she rightly mentioned, Sukriti, the color may change towards congested color, which means the gland is getting angry. But it's transient, so you don't have to worry. The more important thing is the fat, which is sentinel pad of fat. For anybody who is interested in knowing all details of this, there is an editorial that I published last year in Indian Journal of Surgery, which is all over, you can see that. On PubMed also you can see. So this is it. So identify by its location. Superior is fixed, inferior is going places with the thymus. Inferior would be seen in the thyrothalamic ligament usually. Superior is in the inferior plane to inferior thyroid artery. And usually in this triangle you find superior, identified by looking at the sentinel pad of fat, the color, the change of color is more important, and finally it's something that you must ensure you don't test by looking at the diffuse blood supply. But if that happens, you find that the blood supply is diffuse. That is what he was referring to. Is that clear to all, everybody? So that's how you identify the parathyroids. And there are usually 4 parathyroids in human beings. What percentage of human beings have 5 parathyroids? 5%. What percentage of individuals have true conjoined tendon? 5%. What percentage of individuals have a missing dorsalis pedis? 10%. But absent dorsalis pedis does not always mean Buerger's disease. Clear? And you can get 5 parathyroids. The 5th one is usually in the thyrothelmic ligament. For all those who assist me, I have always spoken this during surgery. Right, Umesh?
Yep.
We say that thyrothelmic ligament should be carefully dissected. When we are doing the level 6 dissection especially, central compartment is being dissected, we make sure that we do not do recklessly there, because that would lead to ischemia of the parathyroid. And mostly the blood supply to parathyroid is coming from where? Majority of blood supply to the thyroid is coming, Anuradha, from where? To thyroid, inferior thyroid artery, which is a branch of thyrocervical trunk. And superior thyroid artery is the branch of? How do you identify external carotid artery in the neck? One at a time, Dr. Mahinder. Relax, you know the answer.
So it is present in anterior border of vestibulocodomus now.
Okay, starting from here. Sure, yes.
So external is internal and internal is
It's an incomplete answer given in a haste. Answer should be a complete one. External is internal in anatomical location. If external was internal, why should I call it external? It's internal in location. And external carotid artery gives
Branches
branches in the neck, which is more
would
important.
have any dilatation. Internal would have a
That's enough.
carotid body dilatation.
And then internal has a carotid body dilatation, but it's easier to remember what is lying inside is the internal carotid artery, external carotid artery, and what is lying outside is the internal carotid artery. The term internal and external is given because of the one which goes into the cranium, the one which doesn't go into the cranium. And the external carotid artery gives branches in the neck. What is the first branch?
superior thyroid artery.
Superior thyroid artery. What are the last branches? Superficial temporal and maxillary artery. These are the terminal branches. And what are the branches in between? Pratiksha. Second,
Ascending pharyngeal,
third,
lingual,
fourth,
facial,
fifth,
occipital,
sixth,
posterior auricular,
seventh.
Superficial temporal,
Excellent. See how quickly it was finished. Could you record that? Was it loud enough? Okay. Now that's about this case.
Second is lingual.
It's facial lingual trunk. So it's neither facial nor lingual. And then it divides into a lingual and a facial. So actually lingual comes before facial. But they cross like this, so when you are doing the dissection, you'll find facial first. You ligate facial when we're reaching level 1B, we submit it. Any question in this case? Now we have analyzed the case of thyroid and we have tried to extrapolate it into other few questions which will come around it. But if this was a case of thyroid swelling and you were to present this case, we have made it a point that you don't see the case one day before, you presented it at random as when we gave it as a part of a mock examination. I'll first ask Dr. Umesh, how would he mark him? Then I'll tell you.
I will mark him 8 out of 10.
I'll mark him also 8 out of 10. So if this was the case and you were presenting it, there is no reason for anybody ever to attempt giving you less than 70% marks. So keep it up, present it like that. Any question from anybody? Any question from you? Any doubt? Okay. So we conclude that case and we'll move on to the next case, which would be some other system, We have tried to cover, in fact, in the earlier two DVDs, you must have seen a thyroid case being presented. We are just trying to cover up another aspect of it. So we'll hopefully cover it up in the ward rounds also. Right? Thank you.